Hello and welcome everyone. This is Dr. Neil Floch and I'm here at Norwalk office of Western Connecticut Healthcare Network Bariatrics, if you can say all that. I am here to talk to you about bariatric surgery and what you need to do to get started in our fantastic program. Well, first of all, I'd like to say that you have done an amazing thing by signing on and seeing this here today. That means that you are interested in weight loss surgery, or what we call bariatric surgery. And it's wonderful to meet you. I represent the Connecticut aspect of Nuvance Bariatrics, and Nuvance is throughout both Connecticut and New York. And we are a wonderful program, and we have well established here in Norwalk and Danbury hospitals. And I'd like to give you some information today about the program and getting going with it. So we are a center of excellence, or an accredited center by the MBSA QIP, if you can say all that. And that means that we've fulfilled certain criteria to be certified by this great center, by the American College of Surgeons and the ASMBS. We're a dedicated team with experience and expertise. We've got low complication rates. We're reviewed every 3 years at both of our hospitals here in Connecticut. Well, what do you need to know about obesity? Obesity is a very, very difficult problem, and it's associated with many medical problems such as hypertension, diabetes, sleep apnea, severe joint problems, reflux, infertility, and most concerning these days are cancers. So people with obesity are also at risk of developing COVID-19 and having a much severe situation with this disease. So there are many reasons to look into losing weight, and especially weight loss surgery. There's certain criteria that you must fulfill in order to be a candidate for this surgery. And you've got to have a BMI, and a BMI is a body mass index of at least 30 to qualify. In very rare situations, you can have a BMI of 30 and diabetes and qualify for the surgery. Most people need to have a BMI of 40, and even if they don't have any medical problems, they'll qualify. And there is a certain range between 35 and 40 where you will qualify for the surgery if you have some of those comorbidities or other medical problems, as I said. You've got to be motivated to undergo this. You don't just have it and you're fixed. There's a lot of requirements. And well, we don't currently operate on patients below an age of 18. And you've got to stop using cigarettes if you do, and you can't be addicted to alcohol or other substances that are illegal. And mentally, you have to be in a good situation to be ready for the surgery. So we always, in our surgical program, want our patients to be in a good place as far as their diet and have a good exercise plan. And we always try to establish this well beforehand by seeing a nutritionist and talking to us. We may actually treat you with medications instead of surgery and want you to do some sort of behavior modification before we consider surgery. And we also have a weight loss surgery program a weight loss program that does not include surgery. But unfortunately, conventional diets alone really don't result in as good success as surgery. So surgery is an excellent option, and we wanted to discuss whether it's right for you. There are several bariatric surgeries, but today we're going to discuss in detail the sleeve gastrectomy, because that is now the most common procedure in this area, composing about 70% of the operations that we do. We also do lapband surgery, gastric bypass surgery, and revisional bariatric surgeries such as long limb bypass surgery and gastric balloon surgery. The sleeve surgery involves removing a portion of the stomach and creating a banana-sized stomach with the use of stapling. Patients are in the hospital one night. They lose about 60% of their excess or extra weight, and it's really well tolerated. People can go back to work in within a week, most situations.
The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.
So, what do you need to do? Well, first, we're going to verify your insurance. And then we're going to do a preoperative, pre-surgical evaluations or initial consult in the office. And that'll be done either by a physician assistant or a surgeon. And after the workup and the complete workup, we'll consider you for surgery. We'll know that you have approval for surgery, and we'll do the surgery. After surgery, we want to see you within 1 to 2 weeks post-operatively. And the surgeon will see you or a dietitian will see you. According to which surgeon you have the surgery with, you may see the surgeon first 3 weeks after surgery. We may prefer to see you every 3 months thereafter, and at year 2 to 3, every 6 months, or annually. We want to see you annually for the rest of your life, basically, which should be a very long time. So we're going to have a close relationship, making sure that you're okay and helping you along the way. So before surgery, we need to consider many different things. We want to initially get a blood workup, see a dietitian, which may mean that you need to see that dietitian up to 6 to 7 months. We want a psychiatric evaluation, which may be a mental health worker or a psychiatrist, and a gastroenterology evaluation, which will entail an upper endoscopy and H. pylori testing. We may need pulmonary testing as well, with a sleep study, chest x-rays, and pulmonary function tests. A cardiac evaluation also. And we want to make sure that certain things are stopped, such as smoking. After surgery, you're going to have adequate nutritional intake, which means cutting down your calorie count to about 1,000 or 800 calories, eliminating simple sugars and carbohydrates, and adding calories without nutrition. We want you to eat about 80 grams of protein and a minimum of 64 ounces of fluid. The bariatric diet guidelines are discussed here. And we're going to want you to have clear liquid diet, bariatric full liquid diet for a week, puree diet, soft diet, and bariatric advanced diet. Ultimately, we want to change your behavior, and such things as eating and drinking at the same time are not good. Physical activity is important, and we have multiple programs that are set up for that physical activity. And we have support groups as well, whether online or in person, whether at Danbury Hospital or Norwalk Hospital. We have support groups here for you to check in and talk to others. So What to expect at a surgery consult? Well, either I or a PA or Dr. Zakala will evaluate you by getting your history, talking to you about the surgeries, the risks and benefits, and eventually we will plan your workup and in the future plan for a surgery. After surgery, you'll be in the hospital for a day and you will most likely be able to go back to work within a week. We're going to want you to recover adequately before you start taking car trips and flying and going elsewhere. And most likely, you're not going to want to lift heavy objects. You should call us if you have any problems afterwards. If you develop swelling or redness or drainage from the wound or a temperature of 102 or severe nausea and vomiting. And the office number at Norwalk Hospital is 203-852-3050. The Danbury Hospital is 203-739-7131. So things to look for: shortness of breath, difficulty breathing. If you start feeling really sick or having chest pain or calf pain, feel confused, or your speech becomes slurred, or you suddenly feel weak. And if you can't make it to the emergency room, call 911. What do you expect? Well, if you expect 60% of your excess body weight loss with a gastric sleeve, or 55 to 60% with a gastric bypass. So exercise for success, exercise daily, eat well, take your vitamins, drink plenty of fluids, and come to your post-op appointments and make lifestyle changes. Next step, we're going to contact you about your insurance, and we'll set you up with either our Danbury location explained here or Norwalk Hospital location, which we can give you in the future. It's important to know that bariatric surgery is safe and effective. There are minimal complications, and patients do very well. Your risk of problems after surgery is small compared to the risks of problems that you can have with obesity. We look forward to going through this journey together, and we hope to see you soon in the very near future.